let's discuss the Chong Mai, penetrating vessels, rebellious Qi. One of the most common pathologies of the penetrating vessel is the rebellious Qi and internal urgency. This has been recognized since the times of the Classic of Difficulties. Chapter 29 of the Classic of Difficulties says, the pathology of the penetrating vessel is rebellious Qi with internal urgency. The internal urgency indicates a feeling of vague anxiety and restlessness. It may also be interpreted on a physical level as uncomfortable, tight sensation from the lower abdomen upwards towards the heart. Modern Chinese book says that internal urgency may also indicate pain, constipation, retention of urine, hernia, anxiety, dizziness, and nausea, especially with an emotional background. Li Shishan said, when Qi rebels upward, there is internal urgency and feeling of heat. This is a rebellious Qi of the penetrating vessel. Rebellious Qi of the penetrating vessel causes various symptoms at different levels of the abdomen and chest. It causes primarily fullness, distension, or pain in these areas. By plotting the pathway of the penetrating vessel, we can list the possible symptoms of rebellious Qi of the penetrating vessel, starting from the bottom. So we have here the schematic representation of rebellious Qi of the penetrating vessels. So from the face, from the uterus and blood, goes to the face, and also goes down from Ren1 to the legs. In the pathology of rebellious Qi, from abdominal symptoms, there is Qi rebellious, and it produces a hot face. Then going to the Qi deficient leg branch, there is a cold feet. So we have here the symptoms of rebellious Qi of the penetrating vessels. There's a feeling of anxiety, restlessness, fidgetiness. There's headache, a feeling of heat in the face, a feeling of lump in the throat, breast distension, pain in women, flutter in the chest or above the stomach, nausea. There's palpitations, like breathlessness, tightness, oppression of the chest, hypochondrial fullness, distension, pain, epigastric fullness, distension, pain, umbilical fullness, distension, and pain. Lower abdominal fullness, distension, pain, irregular, painful, heavy period, hypogastric fullness, distension, and pain. Obviously, not all these symptoms need to occur simultaneously to diagnose rebellious Qi of the penetrating vessel, but it is necessary to have at least 3 to 4 symptoms at different levels. That is in the lower abdomen, epigastrium, chest, and throat. For example, if someone had fullness, distension, or pain of the lower abdomen, that will not be enough to diagnose the condition of rebellious Qi of the penetrating vessel. A feeling of energy rising from the lower abdomen up towards the throat would be a strong indication of rebellious Qi of the penetrating vessel. What makes the Qi of the penetrating vessel rebel upward? So this may happen to 2 reasons manifesting with 2 conditions. One full, the other mixed full or empty. Firstly, the Qi of the penetrating vessel can rebel upward by itself from emotional stress that makes Qi rise or stagnate, such as anger, repressed anger, worry, frustration, resentment. In this case, Qi rebels upward by itself and the condition is full, and this primary rebellious Qi of the penetrating vessel. Qi of the penetrating vessel may rebel upward also as a consequence of deficiency in this vessel in the lower abdomen. In such cases, Qi of the lower dantian is weak and the Qi of the penetrating vessel escapes upward. This is therefore a mixed full or empty condition, and this secondary rebellious Qi of the penetrating vessel. The empty condition is deficiency of blood and or deficiency of kidneys, which may be yin or yang. This second condition more common in women. Li Shishen mentioned the possibility of this pattern when he says, when there is blood deficiency leading to internal urgency, use Dang Wei. The classic categories also hints the blood deficiency as a background for rebellious qi of the penetrating vessel. The qi of the penetrating vessel rises up to the chest. Qi is not regulated and therefore it rebels in the diaphragm. Blood is deficient and therefore there is internal urgency in the abdomen and chest. Primary rebellious qi of the penetrating vessel. The qi of the penetrating vessel rebels upward by itself from emotional stress that makes qi rise or stagnate. So there is a full condition. Secondary rebellious qi of the penetrating vessel. Qi of the penetrating vessel rebels upward as a consequence of a deficiency of blood in kidneys. In this vessel in the lower abdomen. So there's full or empty condition. In particular feature of the syndrome of rebellious qi of the penetrating vessel is that it is characterized by the feeling of heat in the face and cold feet. This is due to the fact as qi rebels upward towards the face, it causes a feeling of heat there. On the other hand, as it rebels upward, there is proportionately less qi in the descending branch of the penetrating vessel, which causes cold feet. In fact, as had been above, the old text specifically says that the descending branch of the penetrating vessel warms the feet. An example of treatment of the primary rebellious qi of the penetrating vessel, example of the full type in women is spleen 4 on the right, pericardium 6 on the left, Li4 on the right, liver 3 on the left, kidney 14 bilaterally, and kidney 21 bilaterally. An example of treatment of the secondary rebellious qi of the penetrating vessel, for example, of the full and empty type, against the background of the blood and kidney deficiency in women is spleen 4 on the right, pericardium 6 on the left, Li4 on the right, liver 3 on the left, kidney 13 bilaterally, Ren 4 and kidney 21 bilaterally. Rebellious qi of the penetrating vessel may also cause dizziness, for which one can use DO 20, bladder 11, stomach 37, stomach 39. Rebellious qi of the penetrating vessel may also cause nausea, in which case one can use bladder 11, stomach 37, stomach 39, stomach 30.